Welcome back to the lecture series on periodontics. In this video, we will be discussing about trauma from occlusion. Let us understand what is trauma from occlusion. The name itself is indicating that the tissue injury is happening because of the excessive occlusal forces. So when there are excessive occlusal forces and these occlusal forces have increased, so these occlusal forces exceeded the adaptive capacity of the periodontium, in that cases, tissue injury results. So this injury is known as trauma from occlusion. Trauma from occlusion is also known as occlusal trauma. Another name for trauma from occlusion is known as occlusal trauma. We often get confused with the terms trauma from occlusion and traumatic occlusion. So there are two things in this. One is the occlusal force. Second one is the tissue injury. When you are referring to the tissue injury, not to the occlusal force, then that is termed as trauma from occlusion. When you are referring to the occlusion, not to the tissue injury which got produced, then that is known as traumatic occlusion. Trauma from occlusion is classified based on two things. One is mode of onset, and the second one is capacity of periodontium to resist occlusal forces. So based on the mode of onset, trauma from occlusion is of two types, acute and chronic. Based on the capacity of periodontium to resist occlusal forces, trauma from occlusion is again of two types, primary trauma from occlusion and secondary trauma from occlusion. Let us first understand about the acute trauma from occlusion. The word acute indicates that the trauma has happened in a very short span of time. Now, example, if the patient is biting any hard substance or if the patient is having the high restorations. So this is a restored teeth and it is having a high point, or if the patient is biting any hard substance, then that can lead to the injury to the periodontal ligament somewhere. So because of this injury, there is increase in the tooth mobility or the tooth pain, and there is also increase in the sensitivity to the percussion. So this kind of injury is known as acute trauma. So usually the patient who is having this acute trauma is presenting the tooth pain and increase in the mobility of the teeth. When you do the sensitivity, so when you are doing the percussion test, he will be sensitive to the percussion. Why do you see increase in the tooth mobility? Because of the damage to the periodontal ligament fibers. So periodontal ligament fiber is anchoring the tooth to the alveolar bone. Because of this damage to the, because of the damage to the periodontal ligament fibers, you see increase in the tooth mobility. This is about acute trauma from occlusion. Next, let us understand what is chronic trauma from occlusion. So, chronic trauma from occlusion. So here, the trauma is happening from a long period of time. Chronic means from a long period. So here, trauma is happening from a long period of time. For example, tooth wear, drifting and extrusion of the teeth. So these processes take some time in the oral cavity to form. In the tooth wear or during the drifting or extrusion, if there is any change in the direction of occlusal forces, then that will result in the tissue injury, but the injury is happening slowly. So this is known as chronic trauma from occlusion. If the injury happens slowly over a period of time because of the tooth wear, because of the drifting or because of the tooth extrusion, then that kind of injury is known as chronic trauma from occlusion. If the injury is happening because of biting a hard substance or because of the high points in the restoration, immediately then that is known as acute trauma from occlusion. So this is the classification which is based on the mode of the onset. Next, there are two factors in trauma from occlusion. One is the occlusal force. Second is the adaptive capacity of the periodontium. So the type of trauma from occlusion depends on these two factors. So if the injury to the periodontium is because of increase in the occlusal force, then that kind of injury is known as primary trauma from occlusion. If the injury to the periodontium is because of the reduced periodontal capacity and not because of the occlusal force, then that kind of injury is known as secondary trauma from occlusion. In primary trauma from occlusion, what happens? The occlusal forces are increased than that of the normal, but the adaptive capacity of the periodontium is normal. Only the occlusal force is getting increased and the injury is happening because of this increase in the occlusal forces. So this kind of injury is known as primary trauma from occlusion. In the secondary trauma from occlusion, injury to the periodontal tissue is mainly because of the bone loss or if there is any periodontal tissue pathology present. So in the primary trauma from occlusion, adaptive capacity of the periodontal tissue is normal, but the occlusal forces are increased. In the secondary trauma from occlusion, tissue injury is because of the reduced periodontal support, but the occlusal forces are normal here. If you found this video helpful, hit the bell icon below and subscribe to my channel and stay tuned to Tooth Fairy Tales for more dental videos.